welcome to Amazing African Spotlight, where we bring you the most inspiring and game-changing stories of African entrepreneurs, innovators, and change makers. I am Temidayo Christy Efumi, and I'm your host on this storytelling series. Imagine being able to access medical consultations, lab tests, medications, and even chronic care management virtually without having a smartphone. Well, with over 80 awards and recognitions for this incredible work under their belt, Zuri Health has accomplished this and much more. Today, they have served over 3 million people across 9 African countries, bringing quality healthcare through various impactful initiatives to everyone, regardless of their location or income level. So our guest today is Daisy Isiaho. I hope I pronounced that correctly.
Yes.
She's one of the amazing co-founders and the chief product officer at Zuri Health, an innovative healthcare platform that connects users to doctors, labs, pharmacies, and wellness tools through mobile apps, SMS, and the web. Zuri Health has gone above and beyond to create platforms, initiatives that allow everyone, including those without a smartphone and those who are not financially buoyant, to access medical care. So in this interview, we are going deep. We will uncover the exact moment Daisy knew she had to take action, the challenges she overcame, the game-changing lessons you can apply to your own journey, and trust me, you won't want to miss the surprising twist in her story. So if you love hearing real stories of Africans making a difference, hit the like and subscribe button and turn on your notifications so you never miss an episode. And let us know in the comments, what's your dream career or business idea? We might just feature a guest to help you on your own journey. So, all right, let's jump in. Hi, Daisy. Welcome to the show.
Hi,
It's nice.
Temidayo. Thank you so much. I'm so honored to be here.
Okay, so can you describe to us in maybe a sentence or more who you are?
So simply, I would say Daisy is a very optimistic and charismatic, very simple girl who thrives in change. I like, change. Whatever you do, don't remain in the same position. So because I always believe, coming into this world, everyone has a purpose. And it could be anything. But for me, what really keeps me going is change and being very optimistic about life.
Wow, I love that word change. I was just meditating on such a word a few days ago, and I realized that it's a necessary part of life, and sometimes we have to be the ones to initiate them. Okay, but an interesting question: if someone made a movie about your life, what would the title be?
The Adventures of Daisy. I think so.
Oh, I love that one.
Yeah, The
I love
Adventures of Daisy summarizes my life.
cool. Okay. Um, okay, so what's one sentence that describes or that best describes your journey so far? Or it could be a series of sentences. I don't know. I don't want to, make you give summarized statements.
So I would say faith-filled, I would say resilient, I would say passion, I would say people and perseverance.
Wow. Wow. I love that. Okay, so can you take a minute to take us back to what your life was like before the journey began, before Zuri Health? What were you doing? What inspired you to, what brought about that spark, before you started out this amazing enterprise?
So luckily, so my journey started, a few years back. Just immediately after campus, studying, I got an opportunity to really work with young entrepreneurs who are looking at building solutions with tech. So my background is in tech. I did maths and computer science. I always loved challenges. I think, studying mathematics, it makes you think critically and logically in different scenarios. And I always like change. I like challenges. I like being thrown into, it's like either you sink or swim. And that was the challenge that positioned itself. So during COVID, I was on lockdown with my mom back at home, and my mom is a medical doctor. So they all have a more, I would say, a medical background, both my parents. And for the longest time, it was my mom's vision and prayer that I become also a medical doctor. But unfortunately, I didn't go towards that journey. So at the peak of COVID-19, as we were building and working, building different tech solutions, I got to interact with my current co-founder, Ike. And this story is very personal to us. So just before Zuri Health, it's actually a father's promise to a daughter. So Zuri Health is named after Ike's firstborn daughter, Zuri, whom he almost lost at childbirth. And this is what really drove our mission to really build Zuri Health. So at that time, as we were building, I was actually completely working on different projects. And he told me, I've been building this, and I think with your expertise and experience, you can really, close that gap and help me build this and make it come to life. So immediately he told me about the Zuri Health as a project. I got completely immense because in my head, I was like, this is the first time my mom will really appreciate what I do, and it will see how we can still utilize technology and I can still find myself back into healthcare. So I took it very personal. And for me, I think also during COVID, it exposed the underbelly of healthcare challenges. So we were able to really scale and grow fast. It was very easy for us to get new market entry because now people understood how technology can be used to provide healthcare accessibility, connecting with doctors, with healthcare service providers, and even impacting people's lives and improving care. So that's just the typical overview of how Zuri Health was born. And 4 years down the line, we've really scaled. Mention has grown. We have presence in 9 African markets, and we don't stop here. We are continuously building.
Wow, this is really an interesting story. Coming from the place of almost losing your child and being inspired by the need for um, technology-backed healthcare due to the COVID. I mean, it was. I would say that it's a solution that came just in time, and I'm really excited for the presence of Zuri Health. But was there any eureka moment, or did you experience any epiphany when you were going to start Zuri Health? What was the exact moment you knew you just had to start?
So I think is when you for me it was COVID because there was like it exposed those healthcare gaps. Right now, even people who could afford healthcare could no longer afford. Even big nations that are even not typical African nations, they were shut down because of COVID. And the fact that we could have audiovisual consultations with different people online is the same way we should be able to utilize this kind of tools to still bridge healthcare. So the aha moment is actually during continuously when we build, there's a lot of always aha moments when you touch someone's life, when you see someone's life change because they got access to care, they're able to get care to things that they would not have accessed. And mainly when you look at the painful problems that we face, most people actually in Africa died due to preventive health. And just to be able to empower the communities, provide free screening, medication, access to care is always a aha moment. And when you're able to also continuously provide that accessibility, empowering anyone with a mobile device, regardless of their location, the health history, wherever they are, to get access to care, that's one of the aha moments because what we say at Zuri Health is typically that access to healthcare is a fundamental human right. So no one should die because they could not access healthcare.
Okay, okay, definitely not. Okay, but just off the books or off the pre sent questions, I would like to know. I'm curious. You started Zuri Health in Kenya, right?
Yes.
Okay. Was there any significant time or story? Because I love that part where you are able to provide healthcare services to people who do not have smartphones. So I want to like sort of narrow down on that a bit because for me that's like the highest point of impact for me personally. I feel like people who are underserved and are
Yeah.
still able to get access to the things that they need, which are basic stuff, then if you can achieve that, then you are really doing something great. How do you pull that off? And what did it start in rural parts of Kenya? Was there any story around that, basically?
So part of our success is our growth through partnerships. So we could not do it alone, and I don't take credit by myself. So there are a lot of stakeholders that play a part in the success of where we've come and also along our journey. Part of them were the telcos that provided connectivity. So even anyone who doesn't have a smartphone, our grandpas in the village, they were able to still chat with a doctor on SMS text. And this was successful, or this worked because of our partnerships with the telcos. So think about it, the likes of Safaricom, Airtel, MTN, Orange, they provided this connectivity. Then we also collaborated with different stakeholders. We partnered with hospitals, with clinics, with pharmacy and labs and diagnostic centers who are our fulfillment partners. And they were able to do last mile delivery of our services and products. We also brought on board different doctors. When you talk about, one of the biggest problem is, first of all, we don't have enough doctors. And the few
Mm-hmm.
doctors that we have, they're always exported outside the continent, or they establish themselves
Yes.
in cities. So you'll find them in Lagos, you'll find them in Nairobi, and they live out people in Sokoto, people in parts like Isiolo in Kenya, and these people don't have this access. So we were able to build an ecosystem working together, and people you would typically consider as our competitors were actually our partners. And I would say these are the key people that really shaped us in, really understanding what role we have to play. Then looking back at also the early, innovators, most of them were built up for smartphones. Everyone was building apps. But when you talk about healthcare, you should not cut or limit people accessing the service because it's one channel based. So our approach was meet people at their point of need. If you're able to afford a bottle of water, you should be able to afford healthcare. So we plugged in our services on multiple channels whereby you can actually get consultations with a doctor, you can order medication, you can book your lab test across any channel as long as you have a mobile phone. So on SMS, on WhatsApp, on a website, and on the applications. And beyond that, we also have our traditional ways in which we reach the underserved communities, where we now have mobile clinics. So these are hospital on wheels, fully embedded with consultation rooms, X-ray room, dental suites, labs, and we can go into the underserved communities and provide care. Then the biggest problem was cost. We were able to really, in the earlier days, provide very affordable healthcare services. But when it comes down to cost, most people typically don't save towards their healthcare. So you'll find that the pain of having a less than 2% in short market, there's the pain of people paying out of pocket, which is extremely expensive. But how do we empower these people? We want to be able to build innovative tools that are actually incorporated in the consumer behavior. So right now we've rolled out our Care Now Pay Later, whereby we tell you you can actually get care on credit. Then you can pay back over a period of time at the point of need, because you never plan to be sick. You don't wake up and say, today I want to get
Mm,
malaria. It gets you off
mm,
guard, right? And then because
mhm,
most people live below $1 a day, you need to understand that they have very limited opportunities to really decide, do they want to spend their full lifetime savings towards getting or paying towards healthcare, or fending for their family to get food and basic needs. So when we are also building around healthcare, these are the different types of issues that we need to navigate around. Also ensuring that you, as an innovator, you still need to build a very innovative, scalable model that will provide, impact towards the entire ecosystem, your end users, the paying customers, the partners, your team members. How are you changing their lives? Okay,
mm.
so that's just how how we were able to really get here. A lot of people, had their own skill set come on board. They had their own ways of contribution, and we are very grateful that we had this kind of foundation in our early days.
Wow. I feel like giving a round of applause. Wow.
Okay.
I love how you guys are just it was like you were seeing small problems at the grassroots level, and then you were coming up with these innovative solutions to them. I mean, and they were not necessarily like big tech solutions, some complicated stuff, just really basic stuff. And then you're able to still deploy your solutions. I'm really excited to hear this. And I really hope everybody listening has been able to like gain one or two insights, because I feel like you don't necessarily need to know everything or have everything before you can solve people's challenges. And I think one significant factor that you've mentioned is partnerships. Partner with people. You'll be able to deploy your solutions. Partner with people, talk to people about what you're doing, let them know, ask them how they can contribute, see how you can exchange value, and you see how you can create even more value for others. I really love this part. So if you could go back and give your younger self one piece of advice, what would it be?
Wow. So if I could go back and give my younger self an advice, I think,
Yes.
you know, there is, you don't need to play small to make others comfortable. And
Mm,
you're actually not too much. You're just right, right? So whatever you have instilled, whatever dreams you have, whatever vision, it's upon you to make it come to life. And
mm,
just forgetting all the voices that tell you no, you're not able to do it and do it passionately.
mm.
That's the advice I would give my younger self.
I love that part where you say you're not too much. You're just enough. You're just the right amount for for the ecosystem. And I think we need everybody's contribution at whatever level. And I'm happy that you're able to do that through Zuri Health. But I know that the journey might not have been so rosy all through. So, and you've also mentioned some challenges that you faced when you were deploying your solutions. But you could talk maybe a bit more personally about this in your journey as an entrepreneur. What's a struggle from your early days that people don't usually know about?
I think the first time was just getting that buy-in, because you get a
Mm,
lot of people, especially when you're at an idea stage. When I tell you as a friend, I'm thinking of doing this, you don't get a lot of people believing in what you're trying to build or if it's going to work. So we had to really, it was really hard for us to really educate and also prove our value again and again. That's part of the issues that we struggled with, that actually we could build a profitable, sustainable health tech business, because we don't have many in the market that can prove, profitability. People assume you're only building a business that, would be only sustainable through donor funding or donor funds.
mm,
But that, trying to get validation for your business and really letting people understand what you're building was very, very challenging in the beginning. And also accessing fund, because you cannot, sometimes it's very hard to build when you don't have the key and the right resources. But we've been resilient, we've been pushing, and we always say nothing is easy. But when things are right in their own time, they just sprout. So for us, it's been a journey where we've been working even through God's grace, because sometimes we make things happen and you're not sure how you got there, but you look back and you're like, this was a promise that, God is holding your hand. You have the
mm,
low moments, you have the high moments, but you never forget why you started, right? So that's
mm.
that's the talk about, like, the struggle that we went through.
Wow. Okay. Through all of that struggle, what was the biggest this might not work moment during the execution phase, and how did you push through that?
So a couple of things. There are a lot of projects that we actually thought that would not work. And,
Mm,
first of all, there was that moment when we had a very dangerously low runway, and we were not sure how to navigate this because there was no money coming in. There was a lot of, startups closing and shutting down. And that's the point where we needed to know that we can't survive on one revenue model. So we had to diversify our revenue streams. The part where it's sink or swim, you have to make it work. Then you had to look at different opportunities, because you have to understand that you have to get the right team on board. So if you go wrong by hiring the wrong team, it can significantly impact your business. You have to work with people, you have to be surrounded by people who are aligned with your vision and with your mission. And then there was a point when we started, most people knew us as a COVID-19 testing company, because we used to do inbound and outbound COVID-19 testing for different travelers. That was during the COVID period. And we knew at some point what happens when we no longer need to rely on COVID tests, right? How do we diversify? How do you utilize the opportunities in terms of we've acquired this number of customers? How do we provide more value continuously, whereby even beyond this, they can still get value, they can still get access to some form of services and help us become, profitable along that. So these are just some of the ways again.
Wow. Wow. Okay. Moving on very quickly because of time. What's the craziest or boldest risk you've ever taken, and did it pay off?
Well, the boldest is, I would say again during COVID, I had to quit, I would say, a fairly well-paying job and joined
Mm,
Zuri Health as we were building. I had When we started out, I remember I went about 3 months without salaries and without pay. It's because I really trusted in the vision. And everyone was so scared, like, okay, people are losing jobs because of the pandemic, and here you are quitting to start something that you're uncertain about. So I look back and I'm like, wow, that was a very big, bold move, I would say, but eventually it paid off. And here we
wow.
are.
I think I can relate, but I'm not going to spill the tea here.
Yeah.
Okay. Okay.
Mhm.
I'm wondering if it's the same answer to my next question, but I would like to hear
Yeah.
from you. What's the single best decision you made for your business or your career?
I think the best decision was being surrounded by a team that cares. So for us at Zuri Health, it's a very personal journey. So I have a very beautiful working relationship with my co-founders, IK entity. We have a very diverse team. Everyone comes on board with their different skill sets, knowledge, and contribution. And I think we've really blended in so well that such that we really understand people's strengths, their weaknesses, and we really understand where we want to see ourselves in the next 5 years, in the next 10 years. So this, I would say, is one of the things that actually resonates. And it's one of the best decisions that we ever made. So we want to be able to build and create a culture very rooted to our mission. And that's our secret sauce.
Wow. I see a theme here. The previous questions, you also mentioned it, and to everyone listening, I think one important thing as an entrepreneur or someone who is building their career is the kind of people you surround yourself with. So if you have a business, the kind of people you hire matters a lot. I heard somebody actually say exactly that. I think just yesterday, building people matters even more than building your business, because if you build people, they'll build your business. So, and at the same time, the kind of people you surround yourself with who are able to push you, who are able to help you carry your vision, who are able to help you define the right vision, will actually determine your success or the success of your business in the long run. Okay. But what's one mistake that turned out to be a blessing in disguise for you, Daisy?
So a couple, again, you're always bound to make lots and lots of mistakes.
Mm,
So one time, sorry, one time we launched our feature too early, and it flopped. We went live into a new market. The partnership that we relied on did not really get to fruition how we envisioned it, but because of that failure, it gave us very raw, real feedback, and we were able to really understand how to navigate the complexities of running health tech startups on the continent. So we had launched in a new market. I'll give you right key example. We went live in Senegal. Then when we launched live, it went super well. Then our partner had internal challenges and we had to shut down operations in Senegal. But even now, that experience, we're always aware of how to be able to de-risk our business, doing extensive research on the different partners, on the connectivities, on the technology, and being able to scale and scale faster with leveraging this. So the Senegal story really shaped us. It paved way for us to really learn mistakes that you should not do again. And we are keen on revisiting and going back live in the market with these strategies in place. Yeah. Then there was the other mistakes that also turned out is being able to understand, the key regulations around healthcare. So understanding that, we're processing a lot of patients' data. Information is highly confidential. You need to be able to build systems that are end-to-end encrypted and ensure that you can securely safeguard, patients' um, confidential information, and also understanding that, providing those gatekeepers, not for everyone to just have access to this kind of data. So right now, when you look at our systems, they're highly secure, and we're fully compliant just to be able to provide, an end-to-end fantastic patient journey.
Wow. I think one thing I'm taking away from that is, the thing is, I just realized if you hadn't started, you would not have discovered all these potential pitfalls, that you eventually experienced. But it also tells me that, even when you do face all of those things, you are definitely going to overcome, and you're going to learn from it for the next move you're going to make. So I think everybody should actually be able to take that away from this. We cannot be wowed by the success, but now we are seeing the back end and the struggles and the mistakes. But we are also seeing that you were able to learn from that and quickly move on, to the next. And you are definitely not going to be making the same mistakes twice. Okay, so but for you, Daisy, if you could teach one success principle to every young African, what would it be?
I think start now, start,
Hmm.
start small, but whatever you do, just start. There's never the right moment to, start building. Whenever I wake up, there's never a time you'll be ready. Even right now, I always still learn along the way. So there's never the perfect moment to start something. If you have the urge, this is the right moment to start. So build whatever you need to build with the limited resources that you have, but eventually people would catch up.
Start now. I'm telling myself that too. Okay. What inspired you the most on this journey and why?
I think this is fairly easy. My mom really inspired me on this journey. I would, every day during COVID, I would watch her wake up, get prepared to go to the hospital to attend to patients. And in my head, I was like, how can I make her life easier? Right. So this is how, she's been very inspirational. And the fact that I'm actually in health tech is just because of her and, her faith, her prayers, understanding that this is where I belong.
Wow, I love that. I believe she's very proud right now. Even though you didn't eventually become a medical doctor, but you're also creating so much impact. I'm sure she's really proud of that. Okay, what's the book, or is there any book or quote or lesson that completely changed your mindset at any point?
Well, this is so one book that I think I've reread it all over the time is The Power of Positive Thinking by
Mm,
Dr. Norman Vincent, which is why I'm very optimistic about life. Like everything that you have to build, your journey as a person has to be inclined by thinking positively. If you always think about the good things will come your way. If you're always scared and thinking about, oh, what if I fail? For some reason, you will fail. I don't know. But when you instill your mindset with positive outputs, when you look at life positively, when you wake up and you're like, oh, wow, I'm just grateful that the sun is out, those things really build you up and give you the right mindset to keep pushing. So for me, it's The Power of Positive Thinking by Dr. Norman Vincent.
okay. The Power of Positive Thinking. I think I started reading that
Yes.
book. I never finished it, but but okay, now
Yeah.
I'm motivated to go find it again. Okay. What do you think is the biggest mindset shift that young Africans need to make?
So I think we now is the future. That's what I would say. And we have to build solutions for ourselves because no one is coming to save us. So it's upon us really build and shape the lives we want. I remember a few weeks ago when Trump cut USAID funding, everyone's like, "Oh wow, so how else do we survive?" No, we actually have the right resources. We need to build with what we have, and we can change our our lifestyles by beginning with the future, step by step. We have the right people, we have the right resources. We can actually work on getting the right leaders. Again, we can work on getting the very right leaders, and I think we have the possibility of making the change by ourselves.
Okay.
Emphasize leaders.
Yeah, leaders. I was just about to say that again. Okay, okay, okay. I won't want to go too deep into that, even though I would have loved to. Um, if your work disappeared today, what would Africa lose?
Oh, that's quite tricky, right? I think if if my work if my work disappeared today, I think, what you're trying to achieve, we're not there. So if Zuri Health disappeared today, I think millions would lose access to care because of what you're trying to achieve. We're trying to build very sustainable solutions, and we want to build that bridge between the forgotten communities and the healthcare that sees them. So if we want to disappear today, I think that's what I would see. Like, most people will not get access to affordable care, but we want to be able to change that. We want to work with the right partners. We want to build very solid, sustainable systems and solutions that can even run without us. We can actually incorporate this in our systems, right? So
Mm,
that's what I think would be. But that's a very interesting question actually to even think about deeply.
yeah, I love that particular question. But it makes us see how significant what we are doing, no matter how little, how significant it actually is, you know. And that will lead me to my next question. How does your work contribute to shaping the future of Africa?
I think we are proving that healthcare innovation can be African led, African grown, and actually radically impactful. And this is how we are shaping the future of Africa, because it starts by us. Yeah.
Okay. I've been African led. So I think what you're saying with that is that it's almost the same thing you said earlier. We don't need to wait for somebody else to come save us. You know, Africans actually taking the bold step to do stuff, to change things, to create solutions to our unique problems and all of that. And I think that would definitely go a long way in shaping our future. Okay, so
Yeah.
but as an African and as an African entrepreneur, what's your boldest vision for Africa in the next 10 years?
So, very interesting. So, part of our mission, vision at Zuri Health is to see people living longer, happier, and healthier lives. And what
Mm,
this means is actually no one should die from preventive healthcare, right?
mm,
Because for us, it's a fundamental human right. So that's what I see in terms of our vision. We want to be able to see people, living longer, happier, and healthier lives. And that's very bold. Irregardless, you need to be able to access some form of healthcare. You should not die because of illnesses like malaria. When we have people now talking about malaria, you should not die from lifestyle diseases. We should be able to manage these healthcare, issues. And I think by empowering people understanding, even a basic thing as how to administer first aid at home, because it starts from home. Taking care of your health, of your bodies, everything starts from the comfort of your home. And you need to empower more people to understand that we can actually empower ourselves. We don't need to be, you know, the leading. I think we are the most underserved continent when it comes to healthcare, right? We bear the highest disease burden in the world, and we want to change that. So this is what I want to see in the next 10 years.
I love that statement. No one should die from preventive healthcare
Sure.
or healthcare issues. You know, I
Yeah.
mean that should be our basic way of life. Like something you can prevent, then nobody should be dying from that anymore. And then we begin to talk about the big stuff. Okay, so we are moving to the end of this interview, and we're so excited. I've been so excited to learn so much about what you're doing, and aside from that, also the principles behind your work. You know, being able to share your worldview, being able to share the lessons you've learned has really helped, even personally for me as well. So, how can people be part of your mission or support what you do?
Well, there's so many ways in which people can support our mission. We are very much open to partnerships and collaboration. You can fund our health innovation. You can simply spread the word because we believe that advocacy is very powerful. And also, it's starting by yourself. Take care of your health. That is actually one of the best ways you can support us. Being keen, empowering people, educating, learning about very simple issues, even at the comfort of your home. You don't need to be a doctor or anyone else, but just understanding that you need to take the right measures towards good health.
Mhm. Okay. Guys, take care of yourself. And you would have really supported Zuri Health. Okay. I know you've had so many awards and recognitions. I was wowed, especially in 4 years. I mean, guys, they've had 80 awards and recognition, not just from local organizations, but also international bodies like the UNDP. So, but can you tell us about one or two that you are most proud of and why it means so much to you?
Well, there's so many actually, as you mentioned. One of the ones that I'm very proud of is when I got to when I got the Bear, Women Empowerment Award, because I
Mm,
like to champion women, to empower women. So that was I was very, very happy about that. We've had also a couple of, innovations and awards from different stakeholders, from Big Pharma, but the ones that really, showcase the impact that we're doing on ground and the work we're doing. The recent one was at the African Tech Summit in Nairobi. We got the, Best Health Tech Award in 2025. We were one of the first Africans to join the Mayo Accelerator program, which shows just our, longer rails in terms of our mission to provide really quality care and collaboration. We have, SANCALPS and NOFI awards from, UNDP Timbuktu. So all these things actually validate and actually acknowledge that we are in the right path in terms of our mission. And we're always grateful, we're very much honored. And we don't stop here. So awards just help you, but the real impact and recognition is from the lives that we change and the champions that we make, the testimonials from the people who've accessed real keen care. That for us is an achievement. Yeah.
mm. Oh, okay. Okay, is there any one project or opportunity you're currently excited about? Yeah.
Absolutely. So so we currently in the process of refining our women's health program, and we also have our Care Now Pay Later project that we are building with telcos, and this will actually unlock healthcare access in a way that we've never seen before. So this is one of the most exciting projects because we see a lot of people saving towards betting and all that. We want to be able to provide access to care, and we don't want it to be I did not access care because I could not afford it. So we're looking at embedding financial layers towards empowering the communities to be able to pay towards their healthcare, diving and driving towards also more insurance, universal health insurance coverage. And I think this way we'll see a very solid community.
Mm. I love that Care Now Pay Later program. It's quite unique. Nowadays, we see that for devices. That's the only one I'm aware of where you can get devices on credit and all of that. But this is the first time I'm hearing about it, something like that, that model being used for healthcare. And I'm like, this is like the most important place. And like you said earlier, you can't really predict when you're going to fall sick. So having people who can, normally afford it, just know that they have access to it anytime is really so much comfort. Okay, as we wrap up, Daisy, can you tell us where you see yourself in the next 5 years?
I would wish to be a unicorn. I will be a unicorn in 5 years. But either way, as a simple girl, I'll still be building. I will still be dreaming, and hopefully leading a continental, network of health innovators, and also uplifting others as I climb. So I want to really mentor more of the younger upcoming women to actually follow in my footsteps and build.
Wow. Wow. I really love that. And I'm rooting for you. I'm rooting for Zuri Health. And I really hope and pray that you will achieve even beyond what you are set to achieve. Okay. Finally, this is the end of the program. Daisy,
Yeah.
can you tell us how people can connect with you and follow your journey?
Well, you can find me on LinkedIn, Daisy Isiaho. You can follow our social media pages, follow Zuri Health on LinkedIn, on all platforms. We're on Instagram, we're on TikTok, we're on Facebook, on YouTube. We actually recently shot a YouTube series called Jerry that is in a very educative way teaching, the young generation around, sexual and reproductive health and contraceptives. So I think if you're, after this call, you can also check out our Jerry YouTube series. It's very engaging, it's very fun, and we're always happy to engage with you. You can also write to us on our emails directly on our website. You can find at zuri.health, and also on our WhatsApp chatbots, Vera, where you'll get key resources, insights, and also get access to care.
Wow. Wow. Thank you so much. Wow. This has been such an incredible conversation. So many golden nuggets and wisdom from you, Daisy, today. And I'm so grateful for that. Just a quick recap of some of the key lessons that I took away from this. And I want everybody who is listening to actually also take notes, especially if you're an entrepreneur. You need to know that you don't need to play small to make others comfortable. Really, in Africa, sometimes we can be very conservative, but you need to understand that you don't need to make others comfortable by making yourself small. And people are so important to building your business, whether the people who are your counterparts or the people that you hire. People are really, really important. So, which part of today's conversation resonated with you the most? Please drop it in the comments and let's keep the conversation going. If you want to follow Daisy's journey and connect with her across all social media platforms, you can do that under the name Daisy Isiaho, as she said, whether on LinkedIn, on Instagram, and they even have a video up. Zuri Health has a video up on YouTube that could be very, very helpful and informative for you. So if you love this episode, don't forget to like, subscribe, and hit that notification bell so you never miss an inspiring story. And share this video with someone who needs to hear it. Okay. Next episode, we have another powerhouse guest who is making an exciting impact on the African continent. And trust me, you won't want to miss it. So until next time, keep making impact and transforming the African continent for good. So see you in the next episode. Bye.
Bye. Thank you, Temi Dio.